Hello, this is the recorded lecture for Chapter 10 of Information Technology for Healthcare Professionals. And what we're going to look at in this particular chapter is various informational resources like computer-assisted instruction, expert system, health information online. And we're going to start to look at how the Internet provides not only information to the healthcare professionals, but also provides information to our patients so they become more informed. WebMD and all the other various sources are available now where patients can go and check out their symptoms and come in with a more specific set of questions and a more informed presence than they did before. They would come in and they probably wouldn't even know what the symptoms meant, and now they can put those symptoms into a piece of software online through WebMD, and it will sort of tell them what their differential diagnosis is, which is good and bad in some ways, because it could be anything from nothing's wrong to something very serious is wrong. So we're going to talk about some of that. We talk about education in the world of technology. Computers have been used in medical education for well over 40 years. And the drill and practice software has been used to teach skills requiring memorization. I remember when ACLS, Advanced Cardiac Life Support, first had developed an online software app, and it was so nice to go through. It would take you through the actual scenarios that you would use in the case of using the ACLS. It provided simulation software, and it literally puts students in a situation that requires some action. So it forces them to work under a very short time frame, so there's some stress involved, and yet teach them how to do the right thing under that stress. Now, one of those pieces of software is called the Visible Human, which is a computerized library for human anatomy at the National Library of Medicine, NLM. And from data to knowledge, users can see the and feel autonomic fly-throughs on the web. And it's kind of interesting. This NLM allows us to, Invisible Human, if you will, allows them to literally walk through the body. There's another software that we use sometimes called Atom, and Atom allows you to move through the body at 1 centimeter a cut at a time. So you can literally go front to back, top down, side to side using this technology. The Visible Human is a computerized library of human anatomy at the National Library, like I said. It's explorable virtual human in development. It includes authoring tools to build anatomical models. And then there's the virtual human embryo, which are images of the human embryo sectioned and sliced electronically, which allows you great control and a better understanding of what's going on. The Visible Human Project Gallery, like I said, is located here. You can see there's the URL there, and we can talk about, you can see how that works. You might want to look that up and just kind of browse through. This looks at the color cryo sections where you literally cut through like a CT scan or an MRI look to the body. Now, computer-assisted instruction, the drill and practice for skills requires memorization. We use it there. It also has that simulation software that simulates a complex process, which uses multimodal approach. So it uses text, uses graphics, uses sound, uses animation, uses haptics, which is a sense or feel. All of those are multimodal, so it kind of puts you there based on this multimodality. Hospitals are using electronic informed consent programs now. The electronic consent programs explain the procedures to the patient. The patient can ask questions and receive answers electronically, and the patient is also informed of the risks and benefits. The iMed consent, which is one of the formats, is used at the VA and in over 190 U.S. hospitals today. So it's well embedded into the systems. As far as simulation software, we have programs using text. Iliad is one. Programs using graphics, and that's the Atom I talked about before. And also virtual reality simulations for surgery, dentistry, bronchoscopy, taking a tube and looking down into the lungs, epidural anesthesia, how to administer an IV, and colonoscopy. So simulation software is allowing practitioners to sort of practice without putting any humans at risk, if you will. This is a simulation of colonoscopy. Literally, you walk through it, and you're going through that process. So it's basically you're doing it electronically, not on a human. So when you get to the human, you're going to be better at the process. Simulation of bronchoscopy, same idea. Now, patient simulators. We have human patient simulators, and we have programmable mannequins that are used quite often now in teaching in almost every acumen, nursing, pre-med, that kind of thing. And so they will inhale and exhale. The eyes will dilate and constrict. You have heart and lung sounds. You can feel a pulse and get a blood pressure. They can react to medication. It's a barcoding process, and they can simulate allergic reactions. So all those are now available with these human patient simulators, which is pretty cool. This is a baby sim, it's called, and so if a baby, you can go through all the simulations with the baby. This is where you sim, where you learn to ambu bag or resuscitate a baby. Here's a doctor examining eye stands, so you can examine your heart sounds here. You can see what's wrong with him, and you can program eye stand, if you will, to present with various symptoms and presentations for given diseases. This is another eye stand looking at an injured football player. So they take this mannequin, they program in that it was injured a certain way, and then they deal with the symptoms of that as they examine him. This is emergency medical services, EMTs, treating what's called MetaMan, which is a virtual emergency mannequin also. So it's been used in multiple different ways. Medical personnel treating airman MetaMan, if you will, in the world of an air disaster of some sort. Here's nurses examining MetaMan, and like I said, nurses can use it to do their review of systems and all of that. Here's nursing systems practicing on MetaMan where there's an arrest. Here's a nursing systems practicing on MetaMan again during arrest. They do chest compressions, which by the way are measured by the machine to see if they're adequate. The resuscitation, the ambu bag, the quality of that is measured by the machine to see if it's adequate. So you really get a feel for whether you're doing the things properly. Now, using patient simulators, the students can practice intubations, needle compression of a pneumothorax, insertion of chest tubes, defibrillation, catheterization, endoscopy, bronchoscopy, colonoscopy. Almost any of those things can be simulated. In simulated environments, students can practice in real-world situations like emergency rooms with noise and constraints of space and operating rooms. It allows them to practice within the environment they're going to have to actually work in when they're seeing real live patients. You can also do that distant learning. You can learn in an environment where the student and teacher are not in the same brick and mortar location, and that's the face-to-face. You can use internet resources. A lot of times now we're using web-designed software so that a student can be at home with some apparatus that they are able to connect into the internet, and they can sort of go through the process without literally being in the classroom. We also have decision support expert systems. Expert systems attempt to make a computer an expert in one limited field. The expert systems in medicine include MySyn, internist, POEMS, data bank for cardiovascular disease. All these are expert systems that can be used by specialists to learn a trade. Starting in 2009, doctors in New York State emergency departments were able to use a computer application containing concise guidelines for starting prompt drug treatment that reduced the risk of becoming infected with HIV. So it's training, so you go through a training mechanism through the software. The quality of expert systems vary. In certain areas, specifically drug use and preventive medicine, these systems have shown to improve physician performance and less frequently improve patient outcomes. So it's better treatment, or better training for the physician or the practitioner, but may not necessarily translate to increased patient outcomes for a variety of reasons. CDS prevent medication errors, incorrect decisions, but their effect on ADEs, harm to patients, is not so clear. We haven't really done the studies to look at the outcomes. The quality of expert systems varies. Outcomes were improved on the use of a deep vein thrombosis prophylaxis, that is blood clots. Results with diabetes were mixed. Diagnostic CDS do remind doctors to consider more options in diagnosis when looking at a patient with those symptoms. We can also get health information later, like I talked about. Information is of varying quality. The code of conduct suggested by healthcare professionals disclose sponsorship, distinguish between science and advertising, and allow feedback. So some of the information is paid for by those organizations, businesses who would profit from utilizing a certain drug or a certain mechanism or a certain a piece of equipment. So that's not as good. But there are some other sources, I use WebMD, which is very good, which will take patients through a non-funded or single-funded organization to deal with their disease. Now, health information on the internet, there's kind of an internet divide, if you will, the digital divide. Internet use is not spread equally throughout our society, and because access is pretty important. If you're certain areas where you don't have good access to the internet, then that's a problem. The biggest differences are by age, income, and education. So the older generation does not generally use internet as much as the younger population. If you don't have much money, a computer becomes a luxury, not a necessity. And if your quality of education has not taught you how to use the internet, then you won't have as much access. Many Americans with disability really lack access to the internet, both physically and ability-wise. The medical literature database exists. MEDLARS is Medical Literature Analysis and Retrieval System. It's a collection of 40 computerized databases which are maintained by NLM free via the internet, which includes Medline, its complete database of articles, Sideline or SDILINE, which is recent additions of Medline, AIDSline, which is a database of information on AIDS. So there's all these databases that are available to pull out information. MEDLARS, which is Medical Literature Analysis and Retrieval System, is a collection of 40 computerized databases maintained by NLM, which include, like I said before, CancerLit, which is a database of information on cancer, Medline Plus, which is a database of healthcare information for consumers. So this MEDLARS really supplies those databases. Now this is an Army and Air Force poster from the 1940s, which it's from the Library of Medicine, so it really talks about medicine, if you will, and how we manage that the old way. This is a convalescent training program, which is a movie. We used to use movies in those days, of course, and for patients, if you will. This is a Medline database maintained for consumers. You go on Medline Plus, and it'll give you access to health information and health questions. So databases of drug information include Metaspan, Clinical Pharmacology, ClinicalTrials.gov, and CenterWatch. There's also the PDR, which you can get access to. I think there's a subscription price for that, but you can have access to some of the resources on PDR. Email, patients want it the easy way to communicate with want it as easy as they can to their own healthcare providers. And now we are developing mechanisms that providers can communicate with their patients with email and seek reimbursement for those emails. So it used to be for a great while that providers could provide that service, but they weren't reimbursed for the time. And now we're starting to see some reimbursement that goes along with that. Few healthcare providers really make that available because they have a problem with privacy and liability and time. Sometimes emails it's a little harder when you're not seeing the patient. I think that what we're seeing now is a variation of the Skype program where you have video conferencing, video communication, and Skype may provide an access to patients in their homes using telemedicine. So that may be down the line something we're going to see. Email by 2013, the American Recovery and Reinvestment Act of 2009 calls for including secure email between doctors and patients as part of the electronic health record. So now it would be emails may not be secure because they could be, they could be seen by other people in some cases. In this case, they're more secure. In the Kaiser Permanente study in California, the more a patient with diabetes or hypertension emailed the doctor, the more improvement that patient had. They had more information to work with, more guidance. We can also get self-help on the web for patients. Innumerable sites offer help for any medical or psychiatric condition, and many with disclaimers that they are not responsible for the accuracy of the information. They'll say that, but some other sites also offer prescription drugs information, if you will. So you can look for information, but that site is not. Well, they have disclaimers, so they're not responsible if you either misunderstand or misuse the information. There are also millions of support groups on the web. Also, there are various sites where that support, if you will, foundations that support certain diseases, Alzheimer's, Parkinson's disease, diabetes, on and on and on. And so you'll see some of the bigger patient networks include Patients Like Me, Health Central, Inspire, Cure Together, Alliance Health Network, Diabetes Connect, Diabetic Connect, which has almost 140,000 members. So these are really helpful organizations that provide additional support. The internet allows virtual communities to develop among patients which support people with very rare conditions, allowing face-to-face support, almost like group therapy from patients with other patients who have their similar disease. Now, when you're starting to judge the reliability of information on the internet, you have to look at several things. Is there information on the author, or is there no author mentioned? Is the author reliable? Does the author have other published articles that have been published in reputable peer-reviewed journals? Are the sources reliable? Wikipedia, for instance, is not very reliable. It's an open architecture, which means I can go in and write anything I want, and I'm not held to any level, any standard. Are the sources of funding revealed? If I write an article about a certain new drug and the people that are paying me to do the article are the people that are selling the drug, that's not very good. It's a conflict of interest, and that's the next step. Is there information correct? And then read critically. One article does not answer make, if you will. So if one article may or may not provide all the information you want, and you may want to compare that information to other articles or other sites. Health-related smartphone and tablet computer apps are becoming more available for fitness, diet, exercise, looking at medications and side effects, looking at lab test results, what do symptoms indicate, like I said on WebMD, and also monitoring heart rate. You can there are literally some software apps out there to help you monitor your heart rate, even to see if it's regular or irregular. We can look at fast food calorie counters, a kid's checkup, a T2 mood tracker, and many, many more. There are lots and lots of apps, literally hundreds of thousands of apps for that. This is Medline Plus, if you will, that will help you with health topics and drugs and go over current medication, current health and news about medications and treatments and such. And it's provided by the National Library of Medicine. This is a very, very good source and a very reputable source. There's some self-help software. For instance, the Mayo Clinic Family Health Book on CD-ROM. The Doctor's Book of Home Remedies, medical house calls. All these are self-help, so a patient can do some of the early treatment on themselves. They don't have to run the doctor for a little cold or something. They can start to evaluate themselves. Now, computers can be used in diagnosis and treatment. For instance, CIDI, the Composite International Diagnostic Interview, screens for depression and anxiety. So a person can go through this interview process, this auto-interview process, and allows them to be evaluated for where they might be depression-wise. The CIDI Auto, which is a self-administered, which is using the computer, is a pretty interesting way for patients to sort of gauge where they're at. Now, several programs are used to treat anxiety and depression within the computer diagnosis and treatment system. There's internet-based therapy, InterTherapy it's called, for post-traumatic stress disorder. So some of the group therapy and some of the individual therapy can be accomplished through the internet and not have to go to a certain place or a certain person. They can also be used for online screening programs for anxiety and mood disorders, which have been generally equivalent to assessment by a therapist in person. Now, generally equivalent means that they're comparable. In some cases, not as good. In some cases, as good. It just depends on the level of the person we're talking about, the level of disorder we're talking about, and the ability of the individual patient to utilize the equipment. The use of virtual reality in therapy, cybertherapy, we get exposure to threatening virtual simulation for phobias, which allow patients to sort of visualize a phobia and work through it. Exposure to visual bars for alcoholics. Exposure to virtual slot machines for gamblers. Exposure to virtual social situations for people with social anxiety disorder. So this cybertherapy allows patients to be walked through this in the comfort of their home so they can sort of get desensitized that process and hopefully at some point overcome that phobia. Some experiments have shown that the device does have an effect on actual behavior in the real world, and there are studies being done on this right now. It's a whole new technology, so the studies are not far-reaching. We don't know if there's what the 5-year, 10-year, 15-year, 20-year result is on these studies. Researchers have also attempted to use virtual people to improve the ability of autistic children to think and talk while surrounded by others. Those have been less successful because they do not activate interaction. Autistic children need a specific type of interaction. They have different stimulations, and so the internet may not provide that. Other uses of computers and software in psychiatry, Angelina and SimCoach are virtual therapists which can be used. Use of avatars, which are automated people, if you will, or animated people to increase awareness of other points of view. The use of programs in the treatment of drug addiction. I mean, all these have been used and applied within the system. So we looked at the computerization and treatment and training here in this particular chapter, and you can see it's pretty far-reaching, and literally we're just on the cusp of taking off. All these things that are available are really just entry-level work. Even though they're pretty spectacular, there's going to be much, much more on the horizon within the next 1, 2, 3, 4, 5, 10 years, which will be far more reaching. I believe that at a certain point in the next 5 to 10 years, many patients will be evaluated, treated, and follow-ups will be done via the internet in some manner, and that we'll start to see that that's going to be increasing, it'll be improvement for patients that don't have access. If you have a patient that has a handicap that makes it very difficult for them to go to a doctor or a therapist, they'll be able to do some of that at home. They can have group therapy at home. They can be evaluated at home. They can hook themselves up to some sort of apparatus, and they can go through a reasonable exam or office exam. Those kind of things can happen, are going to happen in their future, because it allows a distance not to be a handicap, if you will, for patients getting medical access. So they can live in the middle of nowhere and still have access via internet in some fashion. That's the end of this lecture. Thank you very much.